Hi, and welcome back to Body Beautiful. I'm Janelle Marie. We are here with Dr. Joseph Mealy in his Walnut Creek office talking all about plastic surgery procedures. We just talked about gynecomastia for men. Now we are going to talk about a very popular procedure, breast augmentation.
Perhaps
Am I right
the
about
most popular.
that? Mm-hmm.
And we're going in the other direction with this one.
How is that?
We're making them bigger instead of smaller.
Seriously?
Yeah.
That's what people want nowadays.
Yes. Well, there are some women who want reductions also, but it's about 6 to 1.
Really?
Yeah, 6 times the augmentations to the reductions.
I know I ask you this every time, but are we working with a different implant now, or are we keeping pretty much on the same ones we've had?
So for the last few years, we've had these gummy bear implants.
Yes.
They're silicone implants that are very cohesive. And the big advantage of those is if they break or even if you cut it in half,
yeah,
it stays as 2 halves. The center doesn't leak. It doesn't run like an oil like some of the older ones.
Which is good.
Much better.
All right, let's get to the pictures because people like the before and afters, Dr. Mealy. First picture, beautiful. After, but what did you do?
So this is a patient who looks great before. She just was used to having larger breasts. After children, they shrank. Mm-hmm. She also had a little bit of sagging, so we did a lift. You can't really see the lift in this picture, but I've done a small lift, a vertical lift, in addition to the augmentation.
And you didn't have to take the nipple off for that one, right? It was just a...
Correct.
Okay.
Yeah, when we do lifts, we leave it attached, leave the nipple, the areola attached to the breast tissue so that it keeps its nerve supply and the blood supply. And
when you do a lift, you have to do what they call the T-scars. Is that on everyone?
There's 3 main types. There's one that's a smaller lift that just goes around the areola. Mm-hmm. There's the lollipop lift that goes around the areola and down vertically. Okay. And then the T one, the inverted T, is more like an anchor shape. So it goes around the areola down and along the bottom. In this case, I didn't need the part along the bottom.
And women are always concerned, but they will fade.
They do fade.
Okay.
And you know, when the nipple's all the way at the bottom and you do breast augmentation, it kind of pushes it farther down. So it's not aesthetically pleasing.
Gotcha. You have to get that back up. How old, let's go to picture number 2 first while I ask, how old do you need to be to get breast augmentation?
So for saline implants, the FDA says if it's totally cosmetic, you can be 18. For silicone gel, they say 22. Wow. But in some cases, with people younger, they have kind of like birth defects. They have one side bigger than the other, or just really no breast tissue at all. In those cases, more reconstructive. And then again, 18 is probably the better number.
And picture number 2?
So this is someone who's very flat. So didn't feel very feminine. And by adding some breast augmentation, we're able to give her back her shape. This is a very early picture, so you can see it looks a little bit full at the top, a little bit tight at the bottom, and that's pretty typical for the first few months, especially when the implant is placed under the muscle. It takes a while for that muscle to relax and give us that teardrop shape we're looking for.
Gotcha. So everything will relax and settle in.
Yeah, and the nice thing is once it does, they stay. So we get a good long-lasting result with these.
What about downtime for breast augmentation? I know you can do different types of breasts with the lift and such, but what are we talking ballpark for downtime?
Downtime, usually a week or 2.
Okay.
Most people by 3-4 days they're driving, end of the week, feeling pretty normal. I just try to limit the really strenuous stuff for a few weeks to prevent problems with either the implant moving or straining the muscle too much.
Picture number 3.
So this is someone very similar, had a little bit of asymmetric breasts. We did a symmetrical augmentation though and gave her a nice result. And she has the typical tan lines after the surgery look.
Yes.
But I always tell my patients they still need to use sunscreen and be good to their skin.
But they look great in a bikini.
Yes.
As we talk about picture number 4, I want to ask, because a lot of women don't just come in for bigger breasts. They come in because they have asymmetry. And there's a lot of that going on where people just don't feel right.
It's called normal.
Yeah.
I mean, there's always some asymmetry. We say breasts are sisters, not twins.
Gotcha.
And we're always trying to make them better. It's hard to make them perfect.
Yes.
But if we can get them closer together, usually people are really happy with that.
I love that. And picture number 4.
So this is someone who had kind of a little bit of coning of the breast, wasn't super happy with the shape, and in her case, we're able to add volume and also round out the breast a little bit.
And when you do breast procedures, are they included with like mommy makeovers a lot of the time, a lot of different procedures as well? You can do all those at once?
Well, the mommy makeover is usually something with the breast as well as the tummy or the body. So it's usually fixing things that happen after pregnancy, though not everyone has been pregnant who gets it done.
All right.
But the combination is good. I usually keep people overnight if I'm doing more things, especially with the tummy tucks, just to add a little bit of safety and make sure they're doing okay that first night.
All right. If you want to see more before and after pictures, you can just go to the websites. It is drmealy.com or sanfranciscobreast.com. If you want information on any of these procedures, call the doctor's office at 925-943-6353. And again, that is drmealy.com or sanfranciscobreast.com. We'll be right back with lots more on Body Beautiful. Keep it right here.